If you get a really bad burn, a doctor will scrape off all of the dead, damaged skin. Then they will cut off a piece of healthy skin from another part of your body.
They mix this up a little bit. This video shows like a full thickness skin removal of the lower back. That's not how it's done. Actually, that thing when you scrape off is actually dermatome, which helps you get partial thickness of the skin graft. So then that partial thickness skin graft is placed over the burnt skin that's removed and stitched in. So this video doesn't explain how the donor site is closed. And so that's my explanation. Partial thickness graft, the skin grows in from deeper areas.
Stretch marks happen when the skin stretches or shrinks quickly, like during pregnancy or rapid weight gain. This sudden change causes the collagen and elastin in the skin to break, which results in small tears. As these tears heal, they form scars, what we see as stretch marks.
Unfortunately, there are no cures for stretch marks. There's no creams or lotions or lasers that work. If they do, they work very minimally. They will never take the stretch marks away. The only way stretch marks are sometimes rid of if they're in certain places where you can excise them, sometimes a tummy tuck. But stretch marks on the thighs, arm, legs, there's really, unfortunately, no cure for that.
This is a compound fracture, and it happens when your bone breaks and pierces through the skin.
Ouch, that looks really painful. And this is a situation that really needs to be taken care of immediately.
To fix it, a doctor will cut open the skin and start to realign the bones.
Usually won't make such a large cut, but just enough to bring the bones back in.
Once they are back in the correct position, rods and screws are inserted. This keeps them securely in place, stabilizing the structure so the bones remain aligned while they heal.
This is something an orthopedic surgeon does, not necessarily a plastic surgeon, but if they have problems with getting infected or the skin, then a plastic surgeon is sometimes called in to help with the wound care that's covering the bones.
If you break a finger, it can be gently moved back to its normal position. Then a piece of metal is placed along the bottom to support it.
Usually injections like lidocaine where you numb the whole finger so that it can be pulled into place. And then x-rays are taken before and afterwards to make sure the alignment's right.
This splint is wrapped with straps to hold it firmly in place, preventing you from accidentally moving it and causing more harm. And this allows the bones and tissue to have time to fix themselves. Weeks later, the splint comes off, and hopefully you can start moving it again.
When the bones are that far apart, that needs surgery. And those tubes on the sides are usually nerves. If those are broken, they're not going to come back. You're going to be numbing your finger. You need surgery for that.
When you get stitches, a doctor threads a needle through your wound and pulls it tight to close the skin. As the stitches hold the edges together, the wound becomes inflamed as new cells begin to repair the tissue.
A plastic surgeon does not do it this way. First of all, we put stitches in multiple layers underneath the skin, and then we put the stitches in the superficial layer of the skin. The problem with doing baseball stitches like this is that leave train track marks, which leads to more scarring.
Afterwards, connective tissues and collagen start to create skin. Then, blood vessels form to nourish these developing tissues, filling in the area. And over a few weeks, the wound will have healed together and the stitches are removed.
For demonstration purposes, a lot of this is true, but they're leaving the wound wide. You leave a wound wide like that, you're gonna have a thick, ugly scar. These are the way surgeons of other specialties close wounds with stitches, but not plastic surgeons. We're better than that.
When a doctor gives you a shot, they can sometimes accidentally push the needle all the way through your vein, which ends up puncturing both sides. Once the needle is removed, it leaves 2 holes in the vein. And before the body can thicken the blood and seal these holes, it bleeds into the surrounding tissues. This leaked blood forms a dark, tender area under the skin, creating bruises and splotchy areas.
So this is called like a blown vein, which happens when you put an IV in or do any type of injection like that, unfortunately. It's worse if a person's on blood thinners because then they can get really severely black and blue. The key is to hold pressure on this for like 5 minutes. Basically what that does is it seals the 2 holes much quicker, and then he can try another spot to try and get it.
When you break your nose, the nasal bones shift out of place, making it hard to breathe and changing the way you look. To realign it, a doctor will gently push the bones and cartilage back into the right position. Then the nose is packed with gauze, and an external splint is sometimes worn, holding everything together to heal.
The only thing I'd like to add, usually it's best to do this in 10 days or less. Once you go past 10 days or 2 weeks, then it's gonna be difficult to shift the bones back in place. You might need to go under anesthesia for that or have surgery in order to do that. If you miss the 2-week window, then sometimes you have to wait like 6 months for everything to heal, and then you have to do a reconstructive rhinoplasty to make things work.
A doctor will make a cut where your ears connect to your head if they stick out really far. Through the opening, they'll fold the cartilage and stitch it in place. Then your ears are repositioned closer to your head, and tiny stitches are placed there to keep them from moving.
Yeah, usually those are absorbable stitches used in the back to close the skin so they dissolve and it really looks scarless.
But in rare cases, the stitches in the cartilage can push through the skin and break, causing your ears to pop back out.
I've had that. I do this surgery quite often, and so I have had on occasion a stitch pop out where I had to go and put it back in, and then rarely I have had a stitch come through the skin. It does sometimes get a little infected. You have to put the person on antibiotics, but otherwise the video is very accurate.
When a wound gets stapled, a doctor holds the edges of the area shut to ensure that they're aligned with each other. Then they use a tool to apply surgical staples across the area.
First of all, usually the area is prepped, draped, and gloves are worn, not usually barehanded like this.
Unlike stitches, this method allows the doctor to quickly close the wound and is often less painful. Once they're all in place, the wound begins to heal, and after a few weeks, the staples are removed.
So the problem is when you leave staples in for a few weeks, that creates a lot of train tracks, which leaves more scarring. So it's not the preferred method by a plastic surgeon.
A circular razor slices around individual hairs from the back of your head. Each one is carefully removed, making sure to not damage the roots.
The hair in the back is permanent for most men, depending on the size of the donor area. It can fill up the whole head. And very fine blade is used to make a very fine opening, smaller than the punch that it was extracted from, so it fits in and stays. Usually got to be careful for 2 weeks, and then a little bit of the hair falls out. You start growing hair around 2 to 4 months, but the final result's 1 year. And that's how hair transplant works. Very good.
A surgeon will remove a healthy vein from your leg if you have a blocked artery.
So usually that's done below the knee, not in the thigh area. It's very common to use what's called the saphenous vein, which is most commonly harvested below the knee.
Then they will open up your chest and stitch one end of the healthy vein to the clogged artery right above the blockage, and the other end is stitched right below it.
So the blood flow is reversed because veins have valves, and if you put it in the wrong way, your vein graft isn't going to work.
If you lose your hand, a doctor will stitch up the wound and you'll have a stump. But if your blood vessels and nerves are in good shape and the conditions are just right, you might have another option. You see, a doctor can take a hand from a donor and meticulously connect the bones, veins, and muscles to your arm. If done correctly, you'll have full control over your new hand, and the skin is stitched to your arm.
You have to take a lot of anti-rejection medications that you would be on for the rest of your life to reduce your immune system so your own immune system doesn't attack the foreign hand that's there. But this is a surgery done. It seems to be very successful. How much function they get, I don't think it's 100%, but they get significant function back, and it can significantly change someone's life for the better.